afternoon. Enjoy it, participate, and have a great afternoon. We usually do on these events. We love these events. It gets us out and gets us in touch with the people delivering services. So with that, I am going to hand over to Abbie Wild and Rukeya Miah to introduce themselves and kick off the session.
Hello everyone, thank you so much for joining. For those of you who don't know me, I'm Abbie Wild. I am the Programme Manager for the Better Births Improvement and Transformation Programme and a midwife by background. Perinatal mental health is something that we are really passionate about, and I am really passionate about as personally and professionally, and we're really pleased to see so many of you here today.
Wonderful, thank you ever so much, Abbie. Good morning everyone, afternoon, evening. My name is Rukeya Miah. Those of you that don't know me, I'm a Deputy Associate Director of Nursing, a Senior Midwife and a Professional Midwifery Advocate. I'm delighted to be here. Abbie's done an amazing job of putting this together, and as Amanda has alluded already, it is one of the most important focuses, especially now, for us as healthcare professionals to understand and be aware so that we can better support our service users. So delighted with this, really. And as Abbie has said, professionally and personally, it is very close to my heart to understand service delivery better. So delighted to be here with you all, and hopefully it is as exciting and what you expect it to be. Brilliant.
So we'd just like to share with you, some of you may have noticed the Menti at the beginning. You can scan the QR code, and we'd like you to join in with some questions that we'll have just scattered throughout this afternoon's event. You can join by scanning the QR code, or you can go to menti.com and enter the code there. It's dead easy to use, and it's a really useful tool that helps us to gather some information from you so that we can use that to inform future events and the work through the programme. So please do join in if you're able to. We'll start by just getting a feel for where everybody is from. So if Eugene, if you'd like to go to the first Menti question, maybe pop the link in the chat as well so that people can access who are joining later, because I know some people are going to be dipping in and out of today's event, with it being quite a long afternoon. Other people have other commitments, but yeah, if you can answer that first question, that would be great. It just gives us a feel for where everybody's from. Fantastic. Whilst you're doing that, I'm just going to share the agenda for today. Okay, so Rukeya and I are going to start by just giving a bit of an update from the previous events that have happened over the last year. And then on to our speakers. We'll have a short break at 1:45 so that people can grab refreshments and have a bit of a comfort break. And then we're aiming to close at 4 p.m. Okie dokie. So I'm just going to start with a bit of a scene
Just to interrupt you, Abbie, just to a quick polite reminder to all our colleagues about keeping our times so that we can have the opportunity to listen to everyone. We're going to be really, really strict, I'm afraid, to try and keep to those times so we can hear you all. Would that be all right? Thank you.
Thank you, Rukeya. Just bear with me whilst I find the right window. Now, I don't know if I shared my sound, so. Oops. Good sound, there we go. So, some pretty stark statistics on that little video there. A little bit emotional. I'm sorry for bringing the mood down a little bit, but I'm going to go on to just talk a little bit about the work that we've been doing over the past year, and how we are hoping to influence these really stark statistics in perinatal mental health. Okay. So this is the second Better Births perinatal mental health event, and the first one was held in April 2021, and that was attended by over 100 people from across all sectors and organisations, and it generated several actions which were taken on through the programme. So this is just some of the things that we've been working on over the past year. So the cross-sector perinatal mental health events, this being the second one. We've developed a perinatal mental health resource for parents and for professionals, and a resource for women and families. We've developed a services directory online. We've started up a clinical forum, the Perinatal Mental Health Learning Collective. And we've started work on the Maternity Circles initiative in collaboration with some of our community partnerships. So starting with the at-a-glance referral pathway. So this was an ask from the first perinatal mental health event. So there was concerns voiced from professionals and from voluntary care sector workers around when and where to refer for a range of different perinatal mental health concerns. So this was developed with all of our partners across sectors, and the aim of this tool is to help direct professionals and voluntary support workers to the right service for a range of perinatal mental health concerns. So this has been distributed across the district to acute and community maternity services, health visitors and voluntary care sector organisations. Another request from the last perinatal mental health event was to work together with partners across the district to develop a services directory specifically for perinatal mental health. So this, along with the at-a-glance referral pathway, has been shared across the district, and both have been distributed in poster format. You may have seen this around the hospital, you may have seen this in community settings, and a handheld diary size for those working in community. Anyone that works in community will know that your little diary is your best friend. It goes everywhere with you, and this can just slot inside the diary, and you've got the referral pathway and the services directory there to hand any time when you're working with women and families. So it's also been shared in an electronic format so that it can be available on GPs' electronic systems. We also developed the parents resource for service users, and the purpose of this was really to raise awareness of how common perinatal mental health concerns are, to reduce the stigma, to try and encourage families to speak up if they've got some concerns around perinatal mental health, to break taboos. So we do know that for a lot of our communities, it's really difficult to come forward and say that they're experiencing mental health difficulties, particularly in relation to pregnancy and the postnatal period. To promote referral into services and to inform families about local services. So this was printed with the services directory on the other side. 1,000 of these were distributed during Maternal Mental Health Week. So we provided some little goodie bags for parents who were attending the maternity units across Bradford and Airedale, with leaflets from some of our voluntary care sector organisations as well, to really promote that referral. And the services directory was also developed online so that anyone can access this anytime. It's got the full range of perinatal mental health supports that's available across the district, and this is on the Healthy Minds website, so that families can see all of the maternity specific services that are available all in one place. I've popped the link to the website on here, and I'm happy to share the presentation after the event if anybody wants to take a look at that. So I've got an update here from the Perinatal and Infant Mental Health Steering Group. So the Perinatal and Infant Mental Health Steering Group has good representation from across the system and reports through into the Every Baby Matters subgroup, which is one of the work streams within Better Births. And the Perinatal and Infant Mental Health links to Act as One programme, so it spans across Better Births and children and young people's wellbeing. We're working as part of the provider collaborative to increase the integration of pathways to mother and baby units, our nearest being Leeds. A focused workshop has taken place to develop the MABIM tool, which is the Mum and Babies in Mind tool, which is a nationally developed resource to support local improvements for perinatal mental health. And we have a future workshop coming up to develop an action plan for the Perinatal and Infant Mental Health Steering Group following the MABIM discussion findings. RIC funding, which is reducing inequalities in communities, for those of you who are not familiar. Funding has been secured for Little Minds Matter and SEEDS, which is Specialist Early Attachment and Development Service for Bradford city areas. And planning work has been undertaken to understand the national and local requirements for increasing specialist perinatal mental health support resource in the district. So attendees at the last perinatal mental health event told us that they wanted a perinatal mental health clinical forum. So the Perinatal Mental Health Learning Collective was set up. And this is chaired by Becky Palethorpe, who's the specialist midwife for perinatal mental health and complex care at BRI, and Lisa Milne, who's the clinical lead for perinatal mental health at Bradford District Care Trust. So this is attended by many of the members of the steering group and complements the work that's being done through that. It's run every other month in the months in between the steering group. And the idea of this is to share learning, learn from serious incidents and case reviews. It features local services, so many local services can come along, tell us about their service, promote referral into their services and explain their role within perinatal mental health. To promote identification of perinatal mental health concerns and referral into the right place. And to inform about referral processes and pathways. Late last year, we held two community engagement events, one in Bradford and one in Keighley. And families told us that they were feeling really isolated. And I think the pandemic has obviously had a massive impact on these feelings of isolation. Families felt that they didn't know where to go for support. So, for example, we had one mum there who had an 18-month-old baby with her, and her baby hadn't been weighed since it was 2 weeks old. And this wasn't a unique experience. This is something that we've heard about from lots of parents, that they feel there isn't that readily available support in community. And like I say, the pandemic has exacerbated this. So the idea of maternity circles came up. Now there's lots of services across the district to support with this list here. So breastfeeding support, smoking cessation, domestic abuse organisations, help with digital inclusion, parent education, advice and signposting to a range of conditions, perinatal mental health, social networking, and we want to bring all of these things together in one place so that parents can support each other. They can build that social network and learn from each other and support each other emotionally, share experiences, and also be signposted into a range of services that are already available, but we're bringing them into the community, direct to the heart of the community, so that families can access those more readily. So through the Better Births programme, we've been working with 3 community partnerships across the district: the 5 Lane Community Partnership, Together for Health, and the Keighley Community Partnership. And we're hoping to develop maternity circles in the heart of those communities in some of the most deprived areas of the district. And those areas have the highest rates of poor maternal and infant health, such as high infant mortality rates. And poor perinatal mental health ties into all of those things there. So if we can start to provide that support network around those families, we will see improvements in perinatal mental health as well. So I'm going to pass on to Rukeya now to talk about the perinatal mental health event earlier this year.
Wonderful. Thanks ever so much, Abbie. So I think you've really nicely set the scene really as to why I got together with colleagues to look at the perinatal mental health event that we did end of March of this year. I was hearing of lots and lots of anxieties with delivering the COVID vaccination programme, which has been and is my key role at the moment and has been for the last year. And the key stark thing that really stands out for me is not looking at vaccine delay and hesitancy in pregnancy in isolation, because it is not an isolation problem. I think we know that from all the learning that the wider health inequalities is linked to the inequalities piece in general, and pregnancy is not unique. You've got pregnant women that we are advising as midwives about the importance of being careful with certain drugs and lifestyle, food, you name it. So that is the agenda, and that's what we're educating and teaching women. But on top of this, we're also got families, as in adults, the wider extended family, who are also experiencing health inequalities, such as in the case of COVID-19. The infection rates are really, really high. So we've got the drug issue for pregnant women, but then also the community, the extended family and wider community saying, well, hang on a minute, here is a vaccine that's been developed very, very quickly, and it's a drug, and you're expecting to have this drug that to us doesn't make much sense. So that led me to look at the different communities, not just South Asian. I think South Asian communities across the district are much more established, but my concerns were mainly around Central Eastern European Roma communities and traveller communities, and the younger communities that probably weren't engaging as much. So we did pockets of work with my team in terms of addressing some of the concerns. But in order to address the vaccine hesitancy, HSC recognised infectious diseases that's affecting women and babies, that we'd had some tragic cases and numbers that you probably weren't always aware because they weren't in the media. But we knew as maternity units that they were coming through our services. So I wanted to get underneath some of those discussions and have an opportunity, a safe and sanctuary where we, the service providers, could be there with the communities. And at that point, the biggest chunk of the community where we held the event were South Asians. We had odd Central Eastern European community members attend, but it was predominantly South Asians. So that led us to have that very quick turnaround to creating a platform as we started to move away from the pandemic isolation and social distancing measures. And we managed to get something like 40 to 50 women and service users mixed in to try and have that conversation with a panel of experts. So clinicians, obstetricians, perinatal mental health consultant and leads that all came, MVP. So there was quite a nice representative group that we could pose some questions, have some answers, but we also wanted to amplify that message. I think traditionally we've been focused on mainstream media being the messenger, being the message and the messenger. And we know from the COVID learning, certainly for my teams and my colleagues, that that doesn't always work because it is down to trust. And I would strongly say that regarding perinatal mental health, one of the key learning and things that we probably need to reach out is use diverse media. So whether it's radio, whether it's television, there is an abundance of ethnic media at our disposal that we need to be utilizing to get the message and be the messenger of that message. So we had at least 5 different South Asian, on this occasion, media channels that amplified some of the sessions, so that people that were feeling more familiar with the channels and network that they tend to be affiliated with and felt comfortable with could then see it in the comfort of their own homes. So that led us to have that event. If you just want to go on to the next slide there, Abbie, please. So then we had women that came forward to talk about 2 cases in particular resonated really on the day. And it takes an awful lot of courage to be able to stand up there in front of 30, 40 people, particularly if you're from a culture where it isn't as openly discussed. So there was the element of being judged and that bravery to be able to share candidly some of the experiences as a young mum. She was a young lady that had a baby, and she was probably about 7, 8 months. So the baby was born during the pandemic. Mum had pre-existing mental health, which was perpetuated by the pandemic isolation and the lack of the family support and network. And she spoke. It was very, very powerful, heartbreaking to hear that she had good support on the plus side from healthcare professionals, which kept her well enough to be able to go through the pregnancy. But it was very, very difficult because she felt that it probably needed to be a little bit more visible in terms of what was available to her. But I think overall she rated it extremely well. On the parallel side to this, the second case, which wasn't actually, to be in fairness, related to an immediate pregnancy, but it was another service user that talked about not being aware and not being prioritized because she didn't quite fit into the perinatal stage. But she said she wasn't aware of some of the services at her disposal. So when Abbie outlined some of the wonderful framework that we've got in place, I'm not so sure that it is as widely known to service users, communities, volunteers, and maybe some of the community healthcare professionals. So my ask really is, what can we do differently to raise the awareness and make people aware in these pockets that I've described, South Asians, the traveller communities, basically to the hard to reach communities. What can we do sensitively, productively to make everyone aware? And as I've suggested, maybe media is social media, i.e. the ethnic platforms, probably are the best ways to reach out and make people aware what their options are, what help is available. So at the very beginning, when I set the event with colleagues, there were key themes, 3 key themes I had in mind. What the impact of the pandemic was on perinatal mental health, why there was vaccine hesitancy and what was leading to delays, if you like, and not just hesitancy. And thirdly, how can we as service providers engage with communities? Because the community, there was 2 others, a counsellor very passionate about collaboration with the NHS healthcare professionals, and another colleague of mental health background that runs one of the Bradford centres. She's a counsellor in mental health. What can we do with the existing communities to bring in that rich framework in and collaborate with us, because they know the communities, they're in trusted places, and what can they do to amplify the message, that message and messenger, because they're key allies into the heartlands of communities, regardless of the cultural background. We really need to engage with them much more than what we're doing currently. And I think the pandemic has shown ways and means that has never been seen in the NHS before. And we do it well, but we could do it even better. So on Tuesday, I had the privilege of joining a national meeting chaired by Professor Sir Chris Whitty. And it was up to 40 people of mixed health backgrounds, and we took our views and ideas regarding tackling health inequalities, and mental health came very high on the agenda. It was very keen to hear and listen, and there were some mental health physicians and service providers, healthcare professionals who were recognising the very pivotal and important role of perinatal mental health and how that impacts and sets the tone for lifelong health well-being. So it's definitely on his agenda, and there's likely to be future meetings where we're feeding into this platform how we feel we can shape it. But certainly from my perspective, having been immersed in the vaccination programme, COVID hesitancy and delays is attributed to the recognition, particularly around perinatal mental health, because pregnant women are one of our highest risk groups, and we can't look at one problem in isolation. And Prof. Whitty was very clear about that it is multifactorial, and it's about getting all those strands and all those layers and using it as the holistic approach, particularly in midwifery world, that we always look at the holistic model of care, and that's where we need to be really. So thank you for listening. I'm very keen to hear your ideas and views. Have we got time for a couple of questions there, Abbie? What do you reckon in terms of times?
Yeah, we definitely do.
Any thoughts there, guys? Any opinions?
Don't be shy.
I mean, I suppose I could use my example. I know I've talked about health inequalities, but I think health inequalities for me isn't just ethnicity. It's social deprivation, it's the age divide as well as gender. I mean, it comes into all kinds of things. It's so sensitive, you know, that if you've got all the other mixes, it really perpetuates and it causes more confusion and more barriers really in terms of people's access and what they feel that they can, or what they're entitled to and what their options are. I mean, any ideas on that, do you think? Any particular groups that are affected more so than others?
If people don't feel comfortable speaking, do you want to pop something in the chat and we can discuss? Come on, we've got lots of perinatal mental health support workers here, people with experiences. Please share with us.
What do you think about the message and the messenger? Do you feel that perhaps we need to do something differently to raise awareness about options of self-referral? Because that was one of the things that really jumped at me at the event, that we put so much effort and time to say that rapid response turnaround within 4 weeks. Am I right, Abbie? In the pathway, there's Kate, there you go, fabulous. Please do come in.
Thanks, Rukeya. I wasn't actually going to come in on what you were just saying. I'm really glad that you pulled out the different things that can impact on access to health and health inequalities, and I totally agree with everything you said. We find with our service, Central Eastern European community and particularly Roma and travellers are our hardest to reach communities in terms of getting the message across. But we also have, and I'll be touching on this in my presentation later because my client's story relates to this, we still have a large number of mums who, when they are asked by anybody, an engagement worker, it doesn't have to be an NHS professional with a lanyard on, if they are asked by anybody how they are doing with their emotional well-being, their first instinct is to be really, really cagey and cautious and not to admit that they are struggling. And as I say, I'm going to touch on that in my client story today as part of my presentation, but the mum in my client story actually genuinely felt that when she was asked by one of our community and engagement team, who many people on this call know, and they're really, really friendly and engaging, and they're not health professionals in that way, that she was asked how she was doing with her well-being, and she thought if she admitted that she was struggling and finding it hard on that day, the next thing that would happen is her children would be removed. And she genuinely, that is what she thought would happen. And that level of the stigmatizing of maternal mental health, perinatal mental health, and being able to admit and share those thoughts and feelings, those difficulties and struggles, it is very, very difficult to break down that level of stigma and barrier to people who really need that support actually being able to access it.
Brilliant. You raise a really, really important point. To use the analogy briefly, and then other colleagues could come in, with the COVID vaccination, we had the same. We had people with lanyards, the clinicians preaching and sending the message or portraying the message. It didn't go down well. So we had the ambassadors, the champions. I just wonder, I don't know what everybody else's thoughts is, whether we need that kind of a platform, that bridge, that go-between, where they'll be in a non-judgmental role and where they can give some of the reassurances around not being judged and there being consequences and implications, but rather that we want to keep you together as mum and baby and provide the infrastructure and support mechanisms to help you overcome and better manage your mental health condition. So that's just a thought. I don't know what everyone else feels, but it certainly worked in reaching out to hard to reach groups of our service users, certainly by having ambassadors of COVID vaccines and champions. A thought there for you to think about.
Yeah, I think it needs to be people from the community that are getting that message out there, like you say, not the health professionals, not the people with the lanyards on, because there is that fear that it's so difficult to break that down. It's so difficult to remove that worry from parents who still believe that if they speak up about mental health concerns, they will have their baby removed from them. And I think that's a big part of the reason why we want to develop the maternity circles, having been inspired by a similar programme over in Kirklees, which is the Anti-PAMS initiative, where it's run by peer supporters. So what the families told them when they were developing the service is they wanted to speak to someone like them. So somebody from their community, somebody who looks like them, speaks their language, has lived experiences like their own. They're more likely to open up and speak about concerns like perinatal mental health or domestic abuse or other concerns that are happening in their life that they wouldn't necessarily tell their midwife, their health visitor, their GP. So I think going forwards, I think that is, the ambassador idea is absolutely key. Something like that, where people can develop those relationships and feel able to open up, and then from that, when they've got a trusting relationship, then be referred on to the relevant organisation. But I don't know how we can break down that myth that should you speak up, you will have your baby removed, and the consequences are, can be absolutely drastic if we don't get that treatment in time.
Seeing as you're all quiet, I'm going to throw another question. What's stopping us from doing something like that? Looking at those communities like our traveller Roma, Eastern European communities, just reaching out into, what could we look at the piggybacking onto the COVID team? I know there's a whole 23 of them that I'm doing some training with them regularly. What's stopping us from maybe having a conversation and offering training and reaching out? Because they're the people that know the community and are at the heart of the community. They are of that community, looks like them, talks like them, and knows the intricacies, the anxieties. What's stopping us? Katie again.
Sorry, me again. I was just going to say that in our service, we are really trying to do that. We are trying to establish connections with different community groups and community sections across Better Start Bradford, which is the area of Bradford where we provide our support. And one of those really key connections for us is Connecting Roma, who are quite active in the Roma strategy. I'm sure talking to people who already know this, but we've built a really strong connection between our Central Eastern European community worker Inna, who is from a Latvian background, and she has built a really strong connection with Daniel from Connecting Roma, and he's coming to speak at our next team meeting. We're really trying to push that connection so that we can have somebody who does look like me, if you like, somebody who has some of those life experiences and can deliver those messages in a way that doesn't seem talking down. And we're really keen to capitalise on that. And I think that's the best way for everybody to get that. We've got to get the message into the community, into people that are trusted within those communities, not just for Roma, but across the board. Rukeya, I'll pick that up with you outside.
Yeah.
All right.
That'd be brilliant. Thank you. What about the younger age group women? We've talked about ethnicity, haven't we, and inequalities, but we've got a sizable portion across the board of young people that are really, really struggling, and that we don't probably know enough. Well, I'm saying I don't know enough, forgive my phrasing, but what can we do to better support that transition with juggling and dealing with a lot of life changes? You know, do we feel that we're capturing and we've got enough awareness and things in place for our young people, young parents, young mums? Any thoughts? Someone different? Any ideas?
I think for me, my experience since taking on the role with My Plan Perinatal is a lot of the younger mums have already got social care involved due to, you know, not being able to cope with being a mum or some form of neglect, or they're in you know, a domestic abuse relationship. And at that point, lots of services get involved then, and then they become so overwhelmed with it. I mean, there's several young women that I've tried to engage with, and because we only offer low to moderate coping strategies for perinatal mental health, they just feel overwhelmed. So it's not that they don't want the support, it's just that they're not in a place to accept it at the moment. And if you get involved with somebody and then you can see a lot of it is trauma-based or it's childhood experiences, and you refer to My Wellbeing College, the person has to wait 3 months before they can pick up that service, because there's got to be a 3-month break between each sort of therapeutic service. So I've disengaged with somebody that, you know, I don't know what's going to happen to her, because the service that she needs is My Wellbeing College, and she can be assessed, but she can't be taken on for 3 months. So that's the difficulty I found since I started doing this role.
I'm really glad you mentioned that, Jane, because that overwhelming is also something that we need to be mindful. But what worries me then is, if there's so many services coming in and coming out, parachuting in, parachuting out, are we in danger of maybe missing some key elements? And that's the risk. I know that we can't talk about something, Abbie, about a case where someone young that we know of, it's tragic really, so I can't say too much about this, but it was a very young person and it couldn't have been overnight. And what you're saying just resonates. Were there so many services in that we've probably missed, or there was a gap somewhere the way we could have dealt with things a little bit differently? I mean, we always do look, don't we? We always reflect inwardly, but it does make you think whether there is too much overwhelming.
But also I think it's because these young mums have never had good parenting from their parents, so they don't actually know how to parent and take care of their babies.
Yeah, you've hit the nail on the head, really. It's at the crux of it. It's that basic, isn't it? And then it just becomes
It is.
Catalyst. Thank you ever so much for that. I think it's Lisa next. Is it Lisa? Have I pronounced it right?
Yeah, you pronounced it right. Yes, Lisa. I just wanted to say about the young parents, because in my previous life, I worked with Family Nurse Partnership in Bradford, and of course, you know, that was partly funded by BSB, and you know, that provided a fantastic service in Bradford, and that connected so many services together. And because, you know, we developed such a close relationship with our young clients, you know, they actually trusted us, and they would let us refer to services, and we could keep an eye on them and, you know, support them. And I just think it's really sad that we don't have that service anymore in Bradford. We've got it in Wakefield, you know, and it's well supported in Wakefield. And I attended the Star Hobson webinar this week, and it was brought up in there as well about, you know, how, you know, gaps in services, you know, perhaps could have, you know, well, we don't know, do we? But, you know, perhaps it could have mitigated the situation there. And clearly it's come up again today as well, you know, that there isn't that sort of continuity for our young people.
Thank you, Lisa. Are we doing well for time, Abbie? Just keeping an eye on that. I think you're absolutely right. I think when something good existed and worked well, and then when that's no longer there, that's when we really feel the gap. But then it's about, maybe for want of a better phrase, what can we put in that gap to make sure that what you said, Jane, that it wasn't overwhelming, and it isn't overwhelming, and there is a very clear, direct oversight of the key basic things that you've talked about, Lisa, where a young person needs that basic health or parent crafts experiences. So one of my backgrounds is transitional neonatal care, and it was detoxing substance misuse women. So I was the lead for setting that up, and it was such a powerful and such a rewarding job, where you saw all this. We had women in for months and months, that they went to mother and baby units, and you were picking up and unraveling and unpicking those complex issues, so that nothing was missed and we could put in the right care with the right oversight. I've just seen something come up, and Sam Britton, teenage midwife, is doing some great work. Yeah. Do you want to say anything about that, Sam? Or is it Katie? Katie, you put about Sam. So Sam Britton did mention and approach me. Yeah, go ahead.
Just picking up on Jane's point about young mums and mums that haven't got good parenting models from their own childhood. We get quite a lot of referrals through Sam Britton for teen mums who live in Better Start, and she has built really good trusting relationships with them. So when she says she's going to refer into a service like ours, we often get much better engagement than we would if those mums had come to us from another source, is our experience, because she's said to these mums, you know, this is a really good service and they will really help you, and she gives us loads of information and background on the referrals, so it's a really good, smooth transition.
I was just going to say,
sorry.
No, I was just going to say that the other thing for me is like the funding that we're getting. You know, our service have only got it for a year, but we can cover the whole of a BD postcode. But lots of the fantastic services, perinatal services, can only cover certain BD postcodes. So a lot of mums are getting missed out because they're not in that area. And a lot of feedback I've had, and this is no slur on health visitors or midwives, it's due to the situation, overwork, too much, you know, and not enough people in that job, that through the pandemic, they've really missed out on the care from the midwives and health visitors because they haven't had that direct contact. And that is one of the biggest issues that I'm finding. I mean, we're supposed to be only working in the perinatal stage, so that's up to babies being 1. But we're getting referrals in for mums whose babies are 9, 10, 11 and almost 12 months old, because they've gone through the pandemic and not had that support. It's nobody's fault, but that's just been the situation. And that's led to mums, you know, becoming anxious or isolated or having no self-confidence or self-esteem in what they're doing because of no one to share that with.
And that's where that social networking is so important, for parents to be able to share with each other and be with other parents that have experienced the same things as them, the same worries, the same concerns, and are feeling isolated. It's so important. I was going to come in following what Katie was saying as well about the teenage mums that are cared for by Sam, and I think there's a lot to be said for that continuity that those young women receive. They see the same midwife throughout their entire antenatal care. They build up that close relationship, and therefore they trust their midwife, and they trust that their midwife is referring them into the right people, and that process is more smooth and more effective because they have that trusting relationship, and not all parents are fortunate enough to receive that continuity.
And just on that point, it's that central person, isn't it, that's got the oversight, I guess, and responsibility, because it can be too many too much help and too many people wanting to help, that something somewhere is at risk of being dropped. So yeah, you're absolutely right about that, Abbie, that central person, go-to person that's going to have the oversight, give the basic life skills, and continue to be that go-to person is absolutely essential for young people, definitely.
I think when
How we're doing.
Oh, sorry, I would just.
Sorry, no, go ahead, Jane.
I think when there's a lot of services involved, if nobody's actually coordinating that care, then that's when things fall apart, because people are, working together.
So we've got 4 minutes until the next speaker, and I believe that Nada is actually working clinically this morning, so I think she will just be joining us at 1 o'clock. So we've got a few minutes. I don't know if you want to review the Menti responses so far, Rukeya. I think Eugene can share his screen and show us what we've got so far if you want to have a quick look.
Some fantastic points, isn't it? Beautifully summarised, I would say, Abbie. I don't know what you think. It's absolutely got key, yeah.
Absolutely.
This
is really valuable to take into the further work of the programme. I think I just saw Amanda's hand go up.
Yeah, I was just thinking, I think this is really interesting because it reflects all the conversations that we've been having, Abbie, around the answers don't lie with us. The answers lie out there in the community, and we need to optimise what's out there in the community. And I love that first box. It just sums it up for me in terms of a group of community people from within who can be trusted. And the word trust is really interesting, isn't it? Because what I've really come to realise is that we don't necessarily hold that trust. That trust lies elsewhere. And once we start to understand that, we can then start to develop services based on that, I think, that are probably more responsive than we can ever hope to achieve, particularly in hospital settings that for us are like second homes, but for lots of people are completely alien and scary. And so I love that box. It's fantastic.
Did I see a comment from Rachel in the chat as well? Do you want to come in, Rachel?
I just noticed a comment that Lisa had said about lots of services, and it's true, with perinatal, it's often up until 12 months, but at Little Minds we do work with families up until age 2, so can give a little bit more of an extended support for the parents who are kind of identified later, or we can work with them from pregnancy right through to when the baby's 2. So just wanting to, and we've extended our reach. So it is so frustrating that we're not all citywide. It'd be fabulous if we could be, and that's our desire longer term. And we're trying our best to kind of try and secure that. But these things are how they are in terms of funding and things. But we have expanded, and we do cover a much wider part of the city now that I've put in the chat.
Yeah,
trying our best.
I was going to say, I know that Lisa Mill's trying to get SMABs to be able to support women up to the age of the child being 2. And if we can get funding for that, that would be great. But there's still a lot of people, isn't there, that are missing out because they're outside of the BSP area.
And it would be wonderful if all of these services did go up to age 2, because we know that postnatal mental health concerns don't just disappear as soon as the baby turns 1. they can surface much later than age 1, and they can certainly continue if left untreated.
And often, you know, women might take time to seek support, so by the time they are doing, the baby might be 7 or 8 months old, and then, you know, how much can you do with somebody in you know, 4 or 5 months? It's hard, isn't it?
And I think for me, I've had mums refer to us that have got like 3 children under the age of 5 and has perinatal mental health. So how do you cope with that? Where are the resources to go in there and the support to help them? Sometimes it's not just the baby. It's, you know, they've got 2 of the young children under 5, and it's so difficult.
Yeah, and I think, you know, we could probably talk about this all day, but, you know, the way that services work with individuals rather than with family systems, you know, because I think CAMS, and, you know, it's absolutely no fault of theirs whatsoever, it's the way the system's set up, but when they've got a child that they're seeing, you know, quite often it's interlinked with what's going on at home, and that might be a parental mental health difficulty that might have manifested initially in the perinatal period, but has been an ongoing problem. And, you know, how do we? Yeah, I won't bring that into this, but yeah, it just, you know, it always makes you think about the extended family and the impact, really. And, you know, a mental health difficulty in a family is never isolated to that person. It's, you know, it impacts everybody. So we need to get wiser about how we work, don't we? Or the systems need to have a little bit of a think.
I wonder whether the family hubs and the funding that comes with that from Start for Life will help with some of this more integrated, more whole family approach. I wonder whether some of that coming on board in the fairly near future will help to integrate more of this better.
I was thinking exactly the same as you, Katie, because that's where it all needs to be under one roof. So people aren't waiting if they've got issues around the benefits or the, you know, sort of like, or they've got children that have been, you know, that they think need assessing for ADHD, and everything under one roof will make such a massive difference.
Yes, yeah,
fantastic views.
Sorry, I can't find my hand up button at the moment, so sorry for just interrupting, but yeah, I agree with what you're saying as well. I think in terms of the maternity circles and in terms of taking it forward and working with communities and building those services, so when the funding does run out, so when people like Better Start go, or the RIC funding is moved or changed, I think, you know, like everybody said, if we work within those communities, we set up those services again with the family hubs and maternity circles, so they're embedded in the community and they can be taken forward by communities as well. So yes, I think it's really important as professionals, you know, we have you know, really rigid and established referrals to professional services, but then equally I think they need to be bolstered with you know, a community offer that will, you know, that will continue regardless of funding. So yeah, it's looking at the whole offer and involving those community and voluntary sectors and padding out the bits that we can't always reach for, you know, lots of different reasons.
Thanks everyone for contributing to the conversations. It's all really interesting and really important stuff. We're just trying to get hold of our next speaker because they haven't arrived yet. So just bear with us for a couple of minutes. We may have to switch the agenda around. So anyone that's speaking today and is ready to present, in case Nada does not appear, say aye.
You can swap me around if you want to.
Thanks, Rachel. I think Rukeya is just trying to get hold of Nada.
I'll try.
I know, like I said before, I know Nada is working clinically, and I think she literally had this 1 hour slot in the middle, so I don't want to jump in and switch the agenda because then we'll have a gap later on, but we'll just give it a couple of minutes and just see if she appears.
That's why I thought it might be better if it's me, because I'm the end, I think, so at least it'd take the run off at the end. So yeah, you'll have to bear with me.
Okay, if you want to just get yourself ready, Rachel, just in case. Have you managed to get hold of Nada, Rukeya?
Yeah, I'm just trying still. If you want to get Rachel in, I don't think that's a bad idea. Would that be all right with you? Well, thank you.
Great. Yeah, if that's okay with you, Rachel, yep, go ahead. Welcome, Rachel.
Okay, I don't feel like I'm fully prepared just this second, so I'll just bear with me while I get got my PowerPoint open twice because I need, once it disappears, doesn't it, once you're presenting all your notes and everything, so just bear with me a second. Okay. Has that come up for you guys? Oh, okay. All right. Yeah, I wasn't quite ready, so please bear with me, everybody. But hi, I'm Rachel Loftus. I'm the specialist midwife in the infant mental health team, Little Minds Matter. I did a presentation at the last event and was really kind of grateful to be asked to come back and do a bit of a follow-up from that. So today I thought I'd focus mainly on kind of the impact on infants, and from that I was going to talk a little bit about attachment. Recently done some training, so bear with me, I'm bringing that into it a little bit because I thought it was brilliant and I thought it was a really easy way to help us think about how attachment works and how it can be affected by what's going on for parents. So I thought I'd start by, if I can get my, bear with me, by just thinking about kind of how a parent's emotional health might affect their infant. And I love this quote by Donald Winnicott, who said, you know, there's no such thing as a baby, there is a baby in someone. And we know that, you know, a human baby can't survive on their own. And it seems really obvious when we're thinking about their physical care needs, but it's also true about their emotional care. So their attachment to their caregiver is as vital as oxygen. And we know this from kind of decades of research. They need to experience a relational connection to another person for their brain's social and emotional and cognitive development to happen. And when the quality of that connection is impacted by adversity, such as, you know, perinatal mental health, this can have sort of significant consequences for their long-term physical and emotional health. And we've seen that in the ACEs research and you know, plenty of other research that's telling us that. And the data tells us that up to 50% of babies in Bradford would benefit from low-level intervention. So babies that have got parents that are struggling with a perinatal mental health difficulty are even more in need of sort of specialist infant-focused work. So I'm going to talk a little bit about the circle of security. So this is a really simple map to help us to understand attachment. I absolutely love a visual. I think it's really helpful to kind of think about some of these complex things in a easy to access way. So this comes from the Circle of Security parenting programme, and it's an intervention that we offer to parents that helps us to share the principles of attachment, of secure attachment, in a gentle way. So when you look at the diagram, there's kind of three elements to it, and this is, you know, people of all ages have these three attachment needs. So there's the what we call the top of the circle, which is that need to explore, to play, to learn, to be supported within that. There's the bottom of the circle, which is where we need protection and comfort and having our feelings organised. And then we also need another caregiver or another person who's available to us emotionally and can be kind and caring and supportive. So the Circle of Security kind of helps us to think about that. And this is from, you know, from, well, pre-birth really, this circle starts. So we know that our attachment to our caregiver starts, you know, from birth, but continues throughout our whole lives. So we all have a circle. that we're on. So when we're thinking about, hold on. My clicky button's not working, sorry guys, I'm having to go on to the thing every time. So when we're thinking about how parents create this secure attachment for their babies, what we think about is that they need to be bigger, stronger, wiser and kind, that they need to be able to follow their child's needs, and that they need to be able to take charge. So no parent can be available on the circle all of the time. And children, especially babies, go in and out on the circle many times every day. You know, you'll often see babies if you're in the park, you know, or little children, they'll kind of wander off and have a little explore, and then, you know, they're always looking back, coming back, you know, and that's kind of how the circle looks in reality. And the literature tells us that if parents could be available to meet their child's needs at a minimum 30% of the time, but with a positive intention to be doing that as much as possible, then that's classed as good enough. So we're not looking for parents to be able to be kind of constantly available. But we also, you know, they also need to be able to get that repair when there has been a rupture and they've not been able to be there to meet their parents, their child's needs. That the repair part is really important as well, that they can go back to their baby and try again. And the key is for them to kind of be this bigger, stronger, wiser kind. But to be able to do this, parents need to have the emotional capacity in themselves. And that's the thing that's sometimes compromised in the presence of a mental health difficulty, and where parents might really struggle. So to make this make sense, because whether it has done from me telling you about it, I'm just going to play you a short bit of a video that just explains the circle a little bit better, and helps us to think about it. Now, hang on. I need to do this from a set point, so just bear with me.
All experience of Let's look at this child. First, he needs to know the freedom and confidence to go out and explore his world. Second, he needs to feel assured that whenever he's ready, he can come back for comfort and protection. Third, he needs his caregiver to be in charge in a kind way. 3 basic needs that can be thought of as going out on the circle, coming in on the circle, and hands on the circle. Let's have a look in more detail. Feeling safe and supported, our children want to discover their world. When going out, they need to know that their exploration is encouraged, that we're right there watching over them, delighting in them, offering help when needed, and ready to enjoy their new adventures with them. And when they're coming in, they need us to refill their emotional cup. This means organizing their emotions and letting them know we are delighted to welcome them back, protect, comfort, and understand them. The key for us as parents is to remain strong and kind while knowing when to encourage their going out into the world and how to be available to welcome them back to us. It's crucial that we learn to identify our children's needs like this, because misreading them, or worse, missing them altogether, can cause pain and frustration. We all know how uncomfortable it can be to be held too close when we want to be out exploring, or kept at a distance when we need emotional support, or simply to be without someone who is bigger, stronger, wiser and kind, who we can trust to understand what we need when we're feeling lost, confused, or out of control. When a child misbehaves,
Okay, so just I think that explains it a little bit better than maybe I can, and it kind of really demonstrates kind of what's going on for children when they're kind of in that relational process with their caregivers and their parents. Now, when we're thinking about parents who are struggling or simply not available to be on the circle with their parent, we might talk about that as being kind of limited hands on the circle. So a parent that's experiencing really high anxiety might struggle with supporting their baby's exploration in the world. That might be really triggering for them, and that might limit them on that top of the circle, and that makes the baby feel uncomfortable. They'll sense that from their parent, or even safe, and they might cling to their parent to kind of reassure both of them, so they can get that close comfort, but without kind of distressing their parent too much. And a parent who's overwhelmed by their own feelings and emotions might really struggle to be available to welcome their baby in when they're needing comfort and to have their feelings organised. So that we talk about that as being a limited bottom of the circle. And again, babies will respond to that by maybe not signalling when they're in distress, or kind of hiding their needs to not distress the parent. And then for parents whose mental health is significantly impacting their ability to kind of function daily, we might even think about hands that are gone from the circle, where children are kind of not able to orientate at all and feel quite left. And you know, these are difficult things for any of us to think about, but I think that this really helps us to identify with what might be going on for parents when they're struggling. So this is another graphic that we can think about in terms of when parents might be struggling. So if they've got limited hands, they might show up differently for their babies than how they might want to, and that might really impact the baby's attachment development. So a parent who's struggling might be mean, so they might punish their child for being upset, or get frustrated or angry. They might be weak. They might just think, oh, just let whatever happen, and that then might make the baby feel quite unsafe because of the lack of boundaries, or they might be just gone. They might not be able to meet their baby at all. So in terms of when we're thinking about this from a baby, an infant perspective, that can be really quite difficult. So I'm going to play another little video if I've got time. Shout up, Abbie, if time's an issue. I've only got a few more slides, but this video can really help us to understand kind of what's going on, what might be going on for parents when they're trying to be available for their babies. And it can also actually help us to think about what might be going on for us when we're working with complex families, or trying to support families. So I'll just put this video. It is a few minutes long, but it's really good, so I hope you enjoy it.
Parents. Throughout history, we've struggled to get it right. We hope we won't pass on our emotional issues to our kids, and we swear we won't make the same mistakes our parents did. We all have great intentions, but something seems to get in the way. Let's look at what that might be. At Circle of Security Parenting, we believe that being emotionally available to our children and their needs is the key to doing our best as parents. We call emotional availability being with. It means teaching emotional intelligence by being with our children in all their feelings, like sadness, joy, anger, curiosity, pain, frustration, excitement, and so on. Being with children helps them understand, trust, and move on from feelings. And knowing someone is with them in their feelings helps children feel less overwhelmed and more secure. Decades of research backs this up. For parents, some of this comes easily, but other times our children express emotions that make us uncomfortable, so we pull away or try to overrule their feelings, which leaves them on their own. We do this because our children's feelings can trigger strong emotions in us. We think of it like this: our history during childhood of how core people responded to our different emotions creates the background music for how we experience our children's feelings. Let's look at this example. This girl and her father have been enjoying time together in the park, but suddenly aware of the time, Dad says, "We need to go." When the girl hears this, she starts crying and gets increasingly angry. All at once, the dad's background music changes. The background music that is playing for the father right now, we call shark music. As it turns out, the dad's own mother was uncomfortable with loud displays of emotion, and she didn't know how to handle them. So throughout his childhood, she repeatedly told her son it was pathetic to cry, and she never ever asked him about his feelings of sadness or anger. His ability to deal with his daughter's emotion now is greatly affected by the experience with his mother then. Shark music. We're rarely aware it's playing, but it's our past experiences telling us to be afraid of or uncomfortable with a feeling or need that is actually safe. When our shark music limits our ability to respond to these feelings, our children learn to hide or feel ashamed of them. This is a problem because we're teaching our children to fear emotions that are actually both safe and essential in life. Most of us experience shark music with one emotion or another, and it's different for everyone. But whenever it is triggered, our ability to respond to our children's needs is limited. The good news is, by simply calling it by name and reflecting on what our children need in the moment, we can turn down our shark music. This is so important because if we can learn to manage our history of negative experiences and perceptions, we can respond to the truth of our child's current situation and be with them in it. Ultimately, this will help our children grow up with a better ability to understand and share more of the emotions they experience. There's no escaping it. Strong feelings are a challenge to manage as parents, but our children always benefit when we have an accurate response to what's happening, rather than reacting to the shark music we're bringing into the relationship. Remember, there's no such thing as perfect parenting, and blame never helped anyone feel more secure. That includes blaming ourselves. But the more often we can identify our shark music, the better off our children will be.
I should have probably given a little bit of a trigger warning before that one, because obviously, this is something that every one of us experiences. We all have shark music, and once you know about shark music, you can't stop talking about it because you see it all the time, you hear it in your own mind all the time. So, but it's a really, really accessible way for us to speak to parents about it and to help them to start to identify and reflect on what's going on for them. And so, does anybody have any thoughts on that before I move along? I know it's can be seen as quite a heavy video, so if anybody's got any thoughts or anything they want to say now, then we can have a chat about that now, or we can wait till the end.
I mean, only to say that I can absolutely relate to that 100% with my own children. I think I have constant shark music going on.
Yeah, we all do. And the video's available to anybody. You can access it. It's a Vimeo video, but if you just put into Google shark music circle of security, it'll bring you up the video. So if you want me to rewatch it in your own time and think about it, there's loads of resources online actually for circle of security. So
it's absolutely brilliant and just so easily accessible, isn't it? It's just so, you instantly understand what,
The actual program is really, really comprehensive as well. It's an 8-week program, and it goes into real, each element of this is really pulled apart. There's lots of work, like lots of activities that go on with it to really help parents become reflective about how they are in the relationship with their children. So it is brilliant. That's why I'm using it today, because I'm loving it at the minute. So
and is this exclusively for up to 2-year-olds?
No,
parents, or is it for all parents?
Circle of security can be used, well, even for adults really. They are just developing an adolescent version, but this circle of security that we're trained in, that we deliver, they recommend from 4 months to age 8. So
yeah, I think it's fantastic. I don't know if you can see, Rachel, because you're sharing your screen, but there's a couple of hands up. I think Amanda's hand went up first.
Yeah, no, I can't see. So could you call out people to chat?
Rachel, thanks for that. And I share with that, it does trigger you a bit, doesn't it? Because it kind of makes you reflect on all the times you've responded, probably when you look back and you think, oh, and I always remember my daughter recording me on my mobile phone, losing it in the car one day, and then playing it back in the hospital pharmacy and saying to me, I don't know how to switch it off. And I just listened to myself and thought, oh my God, what was I doing? I just sound awful. But I'm just reflecting, I'm just thinking, you know, I was fairly lucky mum. I didn't have a big support network, and it's the hardest thing I've ever done. But, you know, you're in a position where I was lucky in lots of other ways, even though we didn't have immediate family. And I just can't help reflect what it must be like for some really challenged families, knowing how I felt and how we can really make sure, because they're the group, aren't they? Those, I mean, everybody's important, but for us, in terms of better births, it's really how we get there. And this feels so sort of easy to listen to, and just to get people to acknowledge that actually it's really, really hard. Just to say that, where the media just, you know, presents this ideal constantly, don't they? This thing of being the perfect person.
Yeah.
And so this for me just feels like the subtext of this is to say, do you know what, it's okay to find this difficult, because actually it really is.
Yeah, I mean, it is. You know, parenting is hard, even if you've got everything that you could ever need to kind of facilitate and support. It's still really hard because, you know, because we all have shark music. So, you know, it's always going to be difficult to manage another person and their emotional kind of regulation and all of those sorts of things. And yeah, I mean, I just absolutely love this. I think it's a really accessible thing for anybody, you know, for professionals, for parents, and it's an international program. It's across the world being used, and you know, it was created by people who used all of the extensive attachment research to pull together something that could make it simple and easy to understand, which I think it does lovely. So I'm glad that you've experienced that as well. Was there somebody else who wanted to say something?
Yes, Jane, would you like to come in?
Yeah, I was just going to say that we've got a WhatsApp group that we run alongside with the mums that are in our service, and they can be part of that even when they leave our service. And I think something like this, to share this on the WhatsApp group, would be really, really good for them. I think they'd really benefit from that.
Yeah, well, like I say, there's lots of resources that are available just to the general public. The shark music video one is the first one that I showed you, which is a much longer video actually, but I just wanted to kind of demonstrate the circle really. But the first one with the shark music one for kind of just general sharing, I think they're really accessible. They're really helpful for helping parents to understand. So I can always send the links for them.
Brilliant, that would be great. Thank you.
Once I've finished presenting, I'll find the links. I'll pop them in the chat.
Thank you.
Thanks, Rachel. Rukeya's got her hand up as well.
Yeah, thank you ever so much. Fantastic presentation. As I was contacting Nada and having the conversation, it's brilliant. It's so simple. So I suppose my ask is, does that come in different languages? And forgive me if you've already mentioned this in audio version. You might have already mentioned and I might have missed it, but because it's so good that it would be useful, especially if it's audio, because not everyone reads.
Yeah, so I know that on YouTube these videos have been put on in a few different languages. The actual Circle of Security course that we're provided with comes in hundreds of different languages, or not hundreds, but lots of different languages. Frustratingly, not Urdu or Bengali or Punjabi, but yeah, so because it's an international program, I think they've tried to meet the needs across the globe really. But it comes in, I think there's about 27 or more different
Could
languages.
we do something, or would it be infringing on copyrights to get it into the South Asian languages? Because it would feed nicely into supporting, or would we need to? Because I think we've put
a request into the Circle of Security International. I don't know where that's up to, but we're trying to get it. The main resources are only available if you're a licensed practitioner. So you've got to have done the 4-day training, and then you get given the resources that you know have got the full package of resources for delivering the training. But like I say, these videos, when I've gone to look for them before on YouTube, I know that they're in. You can find them in all sorts of Chinese, all sorts of different languages on YouTube. So whether they've been done separately from, but I mean, I can always ask whether they'd be happy for us to do a translation for them anyway. Do you know, like if that's something that we could potentially
That'd be
do.
brilliant. Yeah,
So I can definitely email them and see if there's some scope. I think for them to, you know, obviously that for them to develop the whole training package in different languages will take a long time. But if we were prepared to do like the public videos and get a translation on them, then I'm sure they'd be more than happy for us to do that if that's something that we could
because
do.
we're adapting without damaging their material or overarching message. We're just getting it into languages to try and promote it, really. So that would be really helpful if you can. Would you be kind enough to unshare, and then we can see each other, and you might be able to see us as well. Thank you.
Shall I just quickly finish my last couple of slides and then I've literally got 2 slides, and then because if I unshare, I'm scared that I won't reach.
You've got lots of time.
You've got lots of time. Don't rush, Rachel. What we'll do is, because we've switched the agenda around, we've got up until the break. So yeah, take your sweet time.
Well, I'll just finish these couple of slides and then I'll unshare and we can have more of a discussion. But yeah, this one was just to demonstrate really about kind of how the circle of security works from a professional perspective. So what we think about is when parents are struggling to meet their child on the circle, you know, they might not have those hands available, that they might need bigger, stronger, wiser hands on their circle. So that's kind of where we come in. And if we can see that a parent isn't able to be those hands for themselves and they need some help to feel safe and secure, then we could maybe meet that need or find the support that's going to help them to meet that need. So that gives them some capacity to then be able to get their hands back on the circle and be there for their baby. So we quite often think about it as like the hands holding the hands, and helping to prevent the intergenerational transmission of attachment difficulties is just vital. You know, the babies of the parents struggling now with perinatal mental health difficulties are the next generation of parents. You know, and if we can change their experience and ultimately their attachment style and behaviours, then we reduce the likelihood of them experiencing difficulties in the future. And this is the key way that we can reduce the incidence of perinatal mental health in our communities, you know, mental health generally, and in turn reduce the impact on babies. So this was just to kind of highlight that some of the work that we do. So obviously at Little Minds, we offer specialist support to the Bradford district workforce, no matter who you are. If you're working with babies under 2, we can be the hands that hold the hands that hold the hands. So it's just thinking about sometimes our shark music can be playing so loudly that it's really hard for us to kind of get, you know, collect our thoughts and work out what it is that we need to do to manage kind of some of our shark music that's happening when we're working with families. So, you know, Little Minds Matter offer consultation. That can be like an ongoing consultation when it's related to a particular family. You can work with the professional network. It can be a drop-in where you just need to come and kind of maybe offload and think it through a little bit. Or we also offer reflective discussions with different teams. So we do it with teams of midwives, health visitors, some of the other Better Start projects, social care, whoever, you know, if there's a team of people who want to have a regular kind of reflective space to really think through their work and how it impacts them and how that then impacts how they work, then we can do that. And it's a really supportive space, informal space, to just be able to come together as a team and think about the work that you do, and how that affects you and the families that you work with. So we always pop this slide on, so it's just a little slide about our service. So we promote early attachment. We do it through training the workforce, so we've got quite a number of training days and packages that you can access, and all of this I can send links for our Eventbrite and our posters and things. We do consultation like I've talked about. We've got community engagement, so we've got a big social media presence, so if you don't follow us then please do. I'll put those in the chat as well. And then obviously we do direct clinical work with families, and that can be, it all depends on assessment, you know, what the family need, but it'll be some sort of therapeutic intervention. It might be that they come on a circle of security group, they can have circle of security one-to-one, all sorts of different things around kind of psycho education, and then some really kind of in-depth therapeutic interventions for trauma, things like that, where that's needed. So that's it. So let me unshare if I can. Am I back? Am I back? Yes. No. There. Am I back now? I've got so many different screens and things going on. I don't know what's going on. So yeah, any other questions or any thoughts that people wanted to chat about if we've got a bit of time?
I was just thinking as well, when your job's specific just to do certain things, like we can go in, we don't offer as much emotional support as the perinatal peer support service. But like my background is working on the mother and baby unit, where I did all the training about bonding and attachment, and I just can't do it. I can't do it with the mums because that's not what our service is set up to do. It's a shame, but that's how it works.
That's really frustrating as well, isn't it? When you've got the skill, but the system kind of prevents you. Yeah, that's really hard. Sorry, Jane, I missed at the beginning. What service are you from?
So I work for the My Plan Perinatal service.
Okay. Fab. Anybody else have any thoughts, feedback, anything they want to discuss?
I was just having a look at the comments. There's a comment there from Natasha about saying that she loves the videos and it was a great way to explain what clients can do practically to foster secure attachment. Everyone was loving the video. I don't know if Natasha, if you want to come in and just say a bit more, tell us about where you work and what you do, or if you're still on the call. Hi.
Working. Sorry, the internet's a bit slow. From My Wellbeing iApt, I'm part of the perinatal team. Rachel also does reflective sessions with us, which are brilliant. I recommend if you can, join, and we get so much from that. So thank you so much, Rachel, for doing that. In regards to what we do, so we work with clients that have mild to moderate mental health difficulties. And just to point out that we do fast track perinatal clients, so it doesn't have to be the mothers, it's also the partners too. And just to kind of reflect on what you've said there, Rachel, that it's wonderful that we can use this information with our clients, because it's not necessarily just using the knowledge, it's also how do we actually put that into practice on a day-to-day basis. And I think that's what a lot of people, mothers, partners really struggle with. So just a big thank you for doing that presentation.
Yeah, and that's the beauty of the videos, really. I think they're really accessible. They just make sense, that it's not hard. Attachment, when we talk about it, can be really, it's so massive, the research is huge, and it's sometimes hard to explain without making people feel bad, or, I think that's the thing. Whenever we talk about parenting, it's always laden with guilt and with, some difficult thoughts and feelings. But I feel like the Circle of Security have found a way to break that down in a way that kind of doesn't leave you. It really emphasises the thing about blame, and that actually, we only do what we do with the knowledge we've got at the time, and that's really important to remember when we're for ourselves and when we're working with families. Thank you, Natasha.
I think the thing that resonated with me, Rachel, and it's what you said, Jane, is that joined up element of working together and caring, isn't it? I think that's where things do go wrong, or we don't capitalise and maximise the support that's available to mothers, regardless of who or what they are. So I think we could work a little bit more smartly in terms of doing the joined up working, because each joined up process strengthens and supports the provisions even better, isn't it? And I don't know what it is, but that silo working sometimes is counterproductive. And it's not easy, but I think if we could all look, and I certainly try and engage collaboratively where I can in terms of rolling vaccine delivery or other elements of my services that I've been running, is that I've found time and time again, the more that we can do that partnership work that the pandemic demonstrated and highlighted, the better the services are, there's less waste, and we get the best package of care over and over again. And what we're doing today is that element, isn't it? Look at so many different hats and people that have come together, but it's what we do with it, to me, is the essence, isn't it? And review and keep looking at different ways. Definitely very powerful presentation, Rachel. Absolutely loved it. So easy to follow, as usual style. Thank you.
Thanks. Yeah, and I think that's the thing that I really think is that everything we do, everything any of us do, is all relationship based. So that collaborative working, when we get to know each other, when we know, kind of what your dog's called, what cup of tea you drink, these things, they bond us, don't they? They're part of our circle, they're part of our exploration and our nurture. And I think as much as the pandemic has helped us to be able to get together in this kind of way, and bring people together, I think we still miss that. I think the siloing can still be a problem because, when we switch our computer off, we're sat in our house or we're sat wherever we are. We're not having that little chat down the corridor as we walk back to our cars, or, those sorts of things is really missing. So I think just to kind of, when we're thinking about working collaboratively and working together, about the importance of still trying to come together now that things are safer for us to do so, that we need to be doing that a bit more. And but yeah, no, thanks everybody. Thanks for listening and your lovely comments. That's been great.
Thank you so much, Rachel, and thank you for stepping in there and saving the day. So we've got 20 minutes now until the break. We've got time for discussion. We can share some more of the Menti questions and have a bit of a discussion around that. If Eugene, if we've got, I can't see the responses, so I don't know where we're up to, but it might be interesting just to see where we're up to with the Menti questions, and then we can go ahead into the break and people can grab themselves some lunch or a cup of tea. See what we've got here. Yeah, I think the one that stands out to me from those is the financial hardship that so many of our families are facing currently, and it's having such a huge impact on mental health and home environments. I think that's huge.
And also the social isolation. I know we're coming out of the pandemic, but it's still there, isn't it? Where families are having to start going into isolation, and then it's that same perpetual cycle again, isn't it? So that isolation probably also sticks out for me, Abbie, alongside the financial pressures.
I also think the two can impact on each other, because if you can't see your family because you can't pay your bus fare, because you haven't got any spare money this week, then it's actually they're co-impacting on each other.
Yeah, and even the ability to go out, to take your family out for days out, and you can't even go to the park without it costing money because the ice cream van's there, or of being able to afford classes and clubs for your children, which gives them chance to get out and socialize. And like Rukeya said, we've had the impact of the pandemic over the past 2 years, but that continues because people feel isolated, they become isolated, that the ability to get out is, it becomes more difficult because people lose that they lose the networks and they lose the confidence in going out and about, and doing that as a new parent is a very difficult thing to do in normal life, but with the pandemic added in, it makes it even more difficult to get out and socialize, and I think that's so important for new families.
But also, Abbie, access to care, because systems are still stretched, aren't they? I'm hearing it every time and all the time, especially when we've got the community engagement event that coming over chairs. We hear time and time again people struggling, and it's no fault of the GP colleagues that are so stretched and catching up with all the backlog of work, that people can't get the appointments because there just isn't enough appointments to go around. that creates that cycle of ill health that then starts to affect existing mental health or create new mental health. And, you know, what do? That's where you fall back on your community network, your social network. And like you said, the financial elements comes in because people need that access in a timely way, but because there's such a queue. So it's all, you know, cyclical and, you know, impacts on mental health ultimately, doesn't it? Particularly if you're a new mum. Do you think we should go for an earlier lunch if we've not got any more, and then it gives everybody a bit of time? What do you think, Abbie?
I'm happy to do that. Is there any more questions that have been answered yet, Eugene? Are we where are we up to with the Menti?
And people can fill in the boxes if they're near their PC at lunch. I mean, I'm not suggesting you have a working lunch, but if you think of anything, you can continue to populate, can't you? And we can capture
Absolutely.
all of
Yeah.
I'll leave this one on during the break so people can just answer and give their thoughts on why perimental health is important.
Yeah, I think that's a good plan. So shall we reconvene at 2:15 and have a little extended break? People can, oh, sorry. Oh, I've got the break as 1:45 till 2 anyway.
Because we switch things around. That's what I was looking,
Yeah.
but I think we've done
you're
well
on
with
time, Abbie. You're on time.
Okay. Oh, great. Good work. We pulled it back, team. Okay, so we'll reconvene at 2 p.m. Okay, thank you, everyone.